As you know, T-cell redirecting therapies in multiple myeloma is of great interest these days because it's showing very deep and durable responses. However, patients who relapse on one of the bispecific antibodies, they're already at a very advanced stage and they have a very aggressive disease. So we are really interested in figuring out what's the next best salvage therapy after they fail one bispecific antibody. And it's really important to figure out the right or most effective sequential therapy. And in order to answer that question, at Mount Sinai Hospital, we actually looked at 116 myeloma patients who were enrolled on different bispecific antibody trials. And we looked at 57 patients in particular who came off the trials and were not lost to follow-up because we wanted to see what happens after that with these patients. And most of those patients actually went on to another T-cell redirecting therapy after failing one of them. So basically they went on another bispecific antibody or even a CAR T-cell. And interestingly, they still showed very durable and deep responses, and that's by going to a second, third, and even fourth line of T-cell redirecting therapies. And if we're looking at those who have T-cell redirecting therapy as an initial salvage after failing one bispecific antibody, their progression-free survival was very impressive. It was around 28 months. And if we're looking at overall survival as well, we didn't even reach the median overall survival, which was another very impressive thing. So they failed one bispecific antibody, they went on another T-cell redirecting therapy, and they didn't reach the median overall survival. So basically the main message of our study is after failing one bispecific antibody, it's very feasible to go on another T-cell redirecting therapy because it can still show very deep and durable responses. And basically the message we want to say as well is if you have a patient who failed one bispecific antibody, you don't have to deny them the chance to go on to another one because it can be very promising and have very good results.